So, just days ago, Trump signed the One Big Beautiful Bill Act, what I'm going to call the BBB. This is a massive piece of legislation that will drastically reshape our healthcare landscape. And as medical professionals, it is pretty important that we understand how these provisions are going to impact our patients and our jobs. So, in this video, let's dive into the provisions in the BBB that are going to most impact healthcare. We'll look at what the intended goals are of the provisions, and I'll kind of lay out how I believe they're actually going to impact our patients and our healthcare systems. And I'll also explain why I think this bill ultimately fails to address like the biggest waste and abuse in our healthcare system. So watch to the end to see if you agree or disagree with my conclusions. And I'd love to hear your thoughts on this. I certainly don't know everything, and I'm not saying that I'm right. These are just my opinions and my thoughts about things. So I'd love to hear your thoughts and if you agree or if you think these provisions are going to have better outcomes than what I'm predicting. Of course, let's keep it civil down in the comment section. We are adults, we are educated people, and we can have civilized discussions, please. Okay, so let's start with the area that is going to be most impacted, and that is Medicaid. So the BBB enacts nearly $1 trillion in federal Medicaid cuts over the next decade. And this isn't just a budget trim, it's kind of a fundamental restructuring. So the bill is going to mandate like new work or community engagement requirements for able bodied adults that have been added to Medicaid through the ACA expansion. And it's going to make their continued eligibility conditional. It also enforces stricter and more frequent eligibility redeterminations, sometimes as frequent as every 6 months. But of course, the biggest change is that massive reduction in federal Medicaid funds to the states, and also new limitations on how the states can use what are called provider taxes, which are actually a crucial funding source for state Medicaid programs. Now, proponents, of course, argue that these changes will reduce federal spending, encourage self sufficiency, and cut down on what they see as improper enrollment, the idea being that only the truly needy will be left on Medicaid, and that will free up taxpayer dollars. However, for me, this first provision is already starting what I consider like a fundamental imbalance or the thing that's fundamentally wrong about this bill. So these cuts target the patients, most of whom are just regular people struggling to get by. They don't target the insurance companies who are receiving billions of dollars from government programs, while at the same time, they're being investigated by the Justice Department for massive systemic alleged fraud, alleged overpayments due to upcoding and misrepresenting patient illnesses. And they're making billions of dollars in profits every year. Yet instead of these corporate entities being held responsible in any way that I can see or being held accountable, the burden of cost savings to the United States government is disproportionately falling on the shoulders of the most vulnerable patients in the system. And as we'll see in this video later, on the providers and the people who actually give medical care. So let's talk about what the Congressional Budget Office, or the CBO, estimates is going to happen with these Medicaid provision cuts. So they say that the Medicaid provisions alone, not the other things we're going to talk about, but just these things, could lead to between 7.8 and 10.9 million people losing their health insurance coverage. Now, just because they lose their health insurance coverage doesn't mean that they're going to stop getting sick, that they're going to stop having heart attacks, that they're going to stop having accidents. So this is going to cause an increase, a massive increase in uncompensated care costs for our facilities, especially in like critical rural and safety net hospitals. Analysis suggests that by 2034, we could have over $42 billion worth of uncompensated healthcare costs, putting hundreds of financially struggling rural hospitals at significant risk of closure or significantly cutting out their programs like behavioral health or even maternity wards. And from a provider perspective, organizations like the AAPA and many others are projecting severe impacts on our day-to-day work. Unfortunately, we can expect significant job security issues for many healthcare professionals, particularly in specialties or settings that are heavily reliant on Medicaid. And of course, our workload and the complexity of our workload will increase as we manage sicker, uninsured patients and deal with more administrative hurdles. And so, speaking of administration, those administrative burdens are likely going to skyrocket. These new work and eligibility requirements likely won't just affect patients. They'll probably translate into way more paperwork, more verification processes, and more time spent on bureaucratic tasks for healthcare providers rather than direct patient care. Next, this bill directly impacts the Affordable Care Act and the marketplace insurances. Now, and to be clear here as well, I was never a huge fan of the Affordable Care Act, the ACA. I never thought that the solution was to increase insurance use and to send more money to insurance companies. But be that as it may, a lot of people rely on the marketplace to help them afford their insurance. So this bill does not extend the enhanced premium tax credits that have helped, millions of people afford their health care. In fact, these enhancements are due to end at the end of this year, the end of 2025. They're going to be gone. The bill also imposes stricter income verification for new enrollees, potentially slowing down access to coverage. Of course, the goal of these provisions is to reduce federal spending and to promote individual responsibility in insurance selection. Proponents argue that the marketplace may even become more competitive without federal interference. However, the CBO projects that the expiration of these enhanced tax credits, combined with some of the other BBB provisions, will result in millions more uninsured Americans, over 7 million, in fact. And having fewer people paying into the fund means that the premiums and out-of-pocket costs are only going to rise and rise substantially. Some projections show that for like a single 28-year-old adult getting regular silver plan, that their costs could nearly double, and older adults could face even more increases that could exceed $10,000 annually in some states. So this will make insurance even more unaffordable for more patients, with the obvious outcome of being an even larger pool of uninsured patients seeking care, causing further strain on our already burdened healthcare system and our stretched resources and staff. And I have to kind of laugh a little bit at the provisions of creating more financial responsibility. Yes, most every American could be better at handling their finances, and I think we have lost a lot of our own financial responsibility. But the amount of money that individuals are spending on healthcare in the United States is unbelievable. And to think that it's okay to increase those because we're financially irresponsible and that this is going to somehow teach us to be more financially responsible, I think is totally misguided. All right, next, let's look at the impact that the BBB immigration policies are going to have on healthcare, because it is likely going to be substantial. The broad immigration enforcement measures that are being taken right now are, sending a chill throughout the immigrant community. Now, from proponents' perspective, the changes in immigration are aimed, again, at reducing the strain on the federal government and on public benefits that are going towards illegal aliens, and of course, strengthening border security. However, the reality of healthcare, just like many other industries, like the farming industry, are heavily reliant on immigrant work. They are a vital, indispensable part of the workforce, and they fill critical roles, from primary care physicians and nurses working in rural hospitals in rural areas where we can't get U.S. citizens to go work, all the way down to certified nursing assistants and home health aides and people who are taking care of people at the most fundamental level. So Having stricter entry requirements, limiting the amount of visas that are given, increasing deportations, especially with the way that they are being handled, is obviously going to have an effect on the number of immigrant workers that we have. And it's going to exacerbate our already critical staffing shortages. So this means fewer hands on deck in hospitals and in clinics, increased burden and burnout for the remaining staff who are forced to cover gaps. We simply cannot afford to lose these healthcare professionals. But wait, there's more. The BBB also directly reaches into the future of our medical professions by making significant changes to federal student loans, creating substantial new hurdles for the next generation of healthcare providers and professionals. So, starting in 2026, just next year, all subsidized student loans will be eliminated. So, that means that as soon as you take out a loan, the interest starts compounding immediately. So think about doctors. They're going to be the most affected, or I should say, people going to medical school. So they have 4 years of undergrad and 4 years of graduate school. Then they go and do residencies where they're making like less than minimum wage. So for those people, they're going to graduate medical school with 8 years minimum of compounding interest on these high student loans because tuition is ridiculously expensive. Right now, people are graduating with, $250 to $500,000 worth of student loans for most physicians. PAs, I graduated with $150,000 worth of student loans, and that was back in 2015. So these people are having massive loans with the interest compounding from day one that they take out the loans. I can't even imagine what their loans are going to be by the time they are making an income that's even high enough to start paying on these loans. But even more critically for the future of healthcare professionals is that the Graduate Plus loan program will be entirely eliminated for new graduate borrowers starting in 2026, 2027. This is a program that most medical and nursing and other health professionals rely on to be able to cover these exorbitant tuition costs for our advanced degrees. In addition, the bill also makes unfavorable changes, at least for the borrower, to the income-driven repayment plans, as well as the extending the forgiveness timelines if you're doing like public service loan forgiveness. Again, the proponents say that the goal of these provisions is to promote financial responsibility and reduce overall federal debt, and could potentially curb tuition inflation by reducing the federal aid. And I do see that point, that these institutions and higher learning have learned that they can get more and more money because the government will give these loans, so they keep raising tuitions. But the talk about like promoting fiscal responsibility, if you want to become a doctor or if you want to become a PA or an NP or a nurse and you're not independently wealthy, what are we supposed to do? You have to take out loans to pay these incredible tuition costs. It's not like we're irresponsible. It's like we have no choice in the matter. Plus, the loss of these, Grad Plus loans means that many people are going to struggle to like pay for their education. And that's going to either push them towards riskier, like private loans that have even less favorable terms. I mean, the government terms weren't great. Let's be honest, 7% interest is not a great interest rate. But is it going to be even worse with private loans? But it's also going to definitely cut down on the pool of those coming from lower socioeconomic groups and backgrounds, and probably kind of narrow the diversity that we have been seeing in providers and in healthcare professionals. And of course, it's just going to totally deter some people from even thinking about going to medical school, or more importantly, like nursing schools, which may eventually worsen our long-term physician and nursing shortages. Okay, finally, let's look at the Medicare provisions and the Medicare relationship with the pharmaceutical industry. So Medicare had recently established this drug price negotiation program, which was designed to allow Medicare to, bargain to lower prescription drug costs for their members. And of course, what Medicare does, the regular insurance companies tend to follow. So it could have potentially meant lower drug prices all across the board. Well, the BBB includes provisions that directly reverse certain aspects of that new Medicare policy. Under the BBB, there are all kinds of drugs that now will be exempt from being able to be negotiated. And also for those that are still able to be negotiated, there are now limits of how deeply the prices can be negotiated down. Now, the argument for this, and I find this one a bit of a stretch, but the argument for why this is a good thing is that it protects pharmaceutical innovation and incentivizes research and development, ensuring that we have a robust supply of new life-saving drugs down the road. And, the pharmaceutical industry themselves claims that price controls stifle their ability to create these new cures. Well, Johnson and Johnson, I can't remember the exact figure, but they made over 10 billion in net profits last year, and I think Pfizer's net profits was 7 or 8 billion. So these companies are making billions in net profit, but that's apparently not enough to help them to be creative and still continue to make drugs. Anyway, the obvious consequence from this is that seniors and potentially, like I said, all of us are not going to get any decrease in our drug and medicine costs. In fact, the CBO estimates that this reversal alone will result in billions in lost savings for the government itself over the next decade. And of course, for our patients, it means less affordable medications, potentially leading to people not adhering to plans, not taking their medications, and having worse health outcomes. And for Medicare, of course, it means continued financial strain while the pharmaceutical companies get to maintain significant leverage over pricing, all while they continue to rake in billions of dollars in net profit. So I don't know if you agree, but when I put all these pieces together, these provisions, and I look at the pattern of what's happening, for me, it's deeply troubling. It feels like big businesses are getting a pass and can continue to do whatever they want, but we're going to put all of the burden onto individuals who are struggling to get by in this economy. Billions in taxpayer dollars are continuing to flow to insurance companies, even as they face, all of these systemic fraud and upcoding allegations, all while making profits. And this bill further solidifies the financial power of the pharmaceutical companies by crippling Medicare's ability to negotiate drug prices. So it's either that we believe that lawmakers truly, really, truly feel like that the biggest problems in healthcare are individuals who are gaming the system or trying to get a free ride somehow, and who are not financially responsible, that those are the people that are causing the biggest waste and the biggest problems in healthcare. So either we believe that, or they don't want to take on the insurance companies and the pharmaceutical companies and big education because they get a lot of money from those organizations. So let's go after the individuals and make all of our cuts there. I don't know. You tell me if you look at it a different way. And as a side note, while I was doing research for this video, I started to think about how insurance companies can do all of this upcoding and overbilling when we're the ones who assign the diagnoses and the billing codes. What I discovered is really kind of infuriating and surprising that we providers are actually unknowingly complicit in this overbilling. If you want to know how we're complicit in that and how that works, I'm going to do a whole separate video about that because it's a long topic. So keep your eyes out for that. And I'll link it here at the end of this video once it gets ready. So anyway, back to this big, beautiful bill and what it is actually going to mean overall for those of us who work in healthcare or anyone that's considering working at healthcare in the near future. So, first of all, I think it's important to understand that this isn't really healthcare reform, not the way that I see it. I see it as largely like a cost shifting exercise. They're moving the financial burden away from the federal government and placing it on states, struggling healthcare systems, and most tragically, on patients and medical providers and medical professionals. It's not going to improve health outcomes. I don't think anyone thinks that it could. It's largely just penalizing people and is failing to address the inherent waste and bureaucracy that's in the system. So, as a healthcare provider or professional, you may be thinking, like, oh my God, what is going to happen? Well, I don't think it's going to be great. I hope to be proven wrong, but things happen incrementally, usually. And so it's kind of like the frog in the boiling water. We're going to get used to it. We're going to adapt and change along the way to an extent. And we probably are going to be stretched even farther than we are now, which we didn't think was possible. But there are a few things that I think that we should be doing as providers right now to get ready for this. So one thing that you can do is to take stock of your current employment situation. Maybe talk to the billing office, find out how reliant your clinic or your organization is on Medicaid funding, and then also look and see if your state is highly reliant on Medicaid. You'll need to consider these things and think about the potential impact on job security in your organization, but also in your state. It might be a strategic time to consider moving to another area of medicine or potentially even moving to another state that is not quite as Medicaid reliant. We also need to up our financial literacy professionally and personally. I think we need to better understand how our organizations do their billing, like where the funding comes from, and kind of get a little bit better understanding of that intricate web of payer systems and advocate for more transparent pricing for our patients. Of course, I think people should also be taking stock of where you are personally financially with the understanding of how your job may be affected with all of these changes. Work on strengthening your personal financial situation through budgeting or investing or whatever it may be to help get you ready to weather any storm or just blips that come up from these provisions. With the increasing work that's on the horizon and increased administrative burden and potential instability in traditional employment, this may be a great time to look at starting your own business, get a side hustle, diversify your income, or even build a practice that is like direct patient care where you totally bypass all of these different insurance models. That could be a great move at this point. But of course, there are also plenty of other entrepreneur opportunities. So if you're a PA or an NP and you're interested in learning what those other opportunities are, then check out this playlist here. Well, that's it for now. Please take care, stay sane, and I'll see you next time on the Medicine Couch. Bye.